We've seen numbers that suggest big increases in premiums relative to what people have been paying so far. But it turns out that for a whole lot of folks, there are subsidies that they're eligible for through the exchange. And so the real price that they'll be seeing, at least for a number of folks, is much less than the sorts of numbers we've been seeing in the press over the last couple of weeks. To give you an example, I put together a little table for Jefferson County, Alabama. And what I want to do is sort of look at two individuals, Bob Younger, who's 27, and Mary Middle-Aged, who's 50. They both earn $17,000 a year. And as a consequence, according to the Affordable Care Act, they only have to pay 4% of their income towards health insurance. What that means is they have to pay no more than $57 per month. Now, if you go to the insurance plans that are offered in the exchange in Jefferson County, you see that Bob would have to pay a premium of $212, Mary $360. But they each get that subsidy. Neither of them has to pay more than $57 a month. So rather than those $200 and $300 plus premiums, they're each only paying $57. And that's an important point to appreciate here, is if your income is sufficiently low, there are rather large subsidies available. Lower down on that table, Bob and Mary each make $35,000. There, the premiums, as it turns out, are exactly the same because they are fully determined by your age, not by anything else. But in this case, Bob is no longer eligible for a subsidy, and Mary still gets one. She has to pay $277, but that's still substantially less than the price she would see in the exchange before the subsidy. That's kind of a surprise in all of this. I mean, one of the things that we've seen over the last few weeks is a very sort of aggressive discussion in the press, quite correctly, that folks who have health problems are the ones who are disproportionately going to enroll, and younger people, because they see higher premiums, are going to be less likely to enroll. And all that's true. But that story is largely driven by the fact that older people have more health problems, and so they have a greater incentive to enroll. But it also turns out that they have a larger subsidy to take advantage of as well.